Welcome to Speaking of Science. The National Institute of Mental Health presents a series of conversations with innovative researchers working in a wide range of disciplines to pave the way for the prevention, recovery, and cure of mental illness.
This study, I think, is one of the richest in the world and unique because we try to put together all of the different facets of health to try to understand the whole child.
Dr. Kathleen Merritt-Kingus of the National Institute of Mental Health is the lead author of a remarkable study into the overall well-being of our children. The National Health and Nutritional Examination Survey, or NHANES, was a collaborative effort between NIMH and the Centers for Disease Control and Prevention. Over a 3-year period, this mobile clinic examined adults and more than 3,000 children, ages 8 to 15. Researchers tracked 6 mental disorders and asked what treatment, if any, the children were receiving. Over 13% of those surveyed were found to have at least one disorder. 8.6% had attention deficit hyperactivity disorder, ADHD, with boys more likely to have the disorder. 3.7% had depression, with girls more likely to have the disorder. Conduct disorder, anxiety, and eating disorders were reported as well.
There's a large number of children who suffer from emotional and behavioral problems. And I think by raising awareness of the extent to which these kinds of conditions the rates are comparable to those of diabetes and asthma and other diseases of childhood are very important, because we don't want to see mental disorders as stigmatized and as some different category of illness when really they're part of mainstream dysfunction or dysregulation of children's functional status.
But when it comes to the critical question of how many children are getting the professional care they need, nearly half of those surveyed had not consulted with a mental health professional, and only 32% of children with anxiety disorder had sought treatment. So why aren't more children receiving needed care?
There has to be treatment that's available. So we have dramatic differences in the availability of help for children in the United States. So in some places we have a fairly large network of support for children with problems. In other areas, we don't have a child psychiatrist within 500 miles to 1,000 miles. Also, of course, money comes into the question because it's very costly to get treatment, because the types of treatment these children may need may be ongoing.
However, this comprehensive survey helps create an important baseline for future treatment, as well as important messages for parents and caregivers.
I think when we take this together with the information that NIMH has on the availability of effective services for children, then I think if we can put this together with that and let people know that there are services available, that children can get help for these things, and most importantly, I think specifically for parents, is that it's not their fault that the children have these conditions, and sometimes they can't manage them themselves, because many of these conditions come with the child. It's not a result of the parent.